Okay, so to wrap up our diathermy conversation, we'll do our application summary. So again, this would be if we had a competency, right? This is kind of the steps you would have to go through. So the effects that we get with diathermy, we can have the thermal or non-thermal. The thermal are all of our general thermal effects, the decreased pain perception, increased metabolism, increased blood flow, the increased tissue elongation is a big one, and the fact that we can do that in deeper and larger volumes of tissue. Non-thermal mainly was all about soft tissue healing. So we got that increased microvascular perfusion, we had the increased phagocytic activities and presence, and then we had the alteration of kind of the cell membranes and that effect on healing. So it was all towards soft tissue healing. Advantages of diathermy, we heat deep tissues. We can get almost 20 to 30 times larger areas than our ultrasound units can. So again, cereal bowl versus ketchup packet. Usually less clinician time. We still are really there supervising the whole time, but we don't have to do and sit there and move the ultrasound head. Disadvantages, it's expensive, it's really bulky heavy, it has lots of restrictions on where it can be placed, so usually you need your own separate room for this. So there's lots of kind of disadvantages with that. So our indications, prior to joint mobilization or stretching, that's a big one. We've seen lots of good research with that. Post-acute muscle strains, joint sprains, contusions, pain, tendinitises, tenosynovitis, bursitis, myofascial trigger points. The joint contractors go up with that prior to joint mobs or stretching. Those are all for our thermal. Obviously, our non-thermal effects could also be for acute injuries and acute inflammation. Contraindications, okay, general heat contraindications if we're doing thermal. We got our implanted pacemakers, our defibrillators, our pregnancy issues. Again, those people shouldn't even be within usually 40 feet of the machine. Cancers, fevers, infections, growth plates, fluid-filled organs. So again, our testes and our eyes. Protruded nuclear pulposa. If they have tuberculosis or peripheral vascular disease, thrombophlebitis, things like that, those would all be reasons to not use it as well. Precautions, especially loop metals, implanted metals that are loops, that's a coil, so they're likely to get their own electromagnetic field around that coil, which could be problematic. Arteriovenous circulatory disorders, osteoporosis, again, menstruation, dressings that are moist. We don't want any fluid in the area. Acute inflammation if we're using thermal. Active bleeding if we're, again, using thermal. And then any sensory impairment. So pre-application steps, again, evaluate the injury, 5 signs of inflammation, make your proper diagnosis, figure out your goals for this patient, and then see if diathermy, if the indications for diathermy match those goals. Check your contraindications. Prepare the patient psychologically, so do a patient-oriented outcome measure. Explain the procedure that it should be gentle warmth, mild to moderate, no pain. Demonstrate on yourself if they ask for that. Check precautions. Patient physically, you want to remove any metal jewelry from the area, from the person. Make sure they're comfortable. Remove especially any synthetic fabrics. Expose the area. Make sure that the patient is positioned properly for us to get the drum or the capacitive plates in place. Also remember to tell them that they're not going to move during this treatment, so they need to be in a comfortable location. We could elevate if we're trying to get some of that edema reduction. That is an indication for diathermy. When it comes time to prepare your equipment, you want to make sure the drum is clean. We want to check the equipment, look for frays or anything else that might make it unsafe. And then we position the equipment, so position the drum or the capacitive plates. If your machine requires spacers, you apply those or use those and then remove them depending on what machine you're using. You want to make sure, again, with the inductive plate that you're about 1/2 inch to 1 inch off the skin or off the towel. You put that terry cloth towel down. With the capacitive plate to somewhere around 3 centimeters. It can go a little bit further out if you're trying to get deeper tissue. But you want to make sure that it's equidistant on each side if you're using the capacitive plates. So then application, again, place the drum, turn it on, set your dosages, so your pulse duration, your pulse frequency, and or your output intensity, your power. One of those you'll get to set. So again, if non-thermal, we're trying to do low pulse durations and low frequencies, low power outputs. For thermal, we want high durations, high frequencies, high power outputs. So it just depends on your machine which of those three you'll get to set. Length of application is going to depend on your heating levels, but it's usually 15, 20 minutes, up to 30 minutes. You would again be asking the patient about the warmth that they experience. You hit start, you adjust your intensity for the patient comfort. Your frequency is 1 to 2 times a day, your duration until your treatment goals are met. So you could do this, as long as you're seeing goals being met, you would continue to use it. As soon as you kind of plateau, you would think about using a different modality or moving them on to something else. But again, exercise #1 modality, so how is this facilitating us getting them to the point that they can actually use that body part and use it effectively. So post-op steps, turn it off, move the drum away, do your patient-oriented measure again, give them instructions, so any self or home treatments. If you're using that vigorous heating, this would be your stretch window. So you'd want to do that before you would do all of your post-application steps. So turn off the machine, move the drum away, and start your stretching, start your joint mob, start your traction. Then you would do your patient-oriented measure, give your instructions, schedule your next treatment, make sure they know their level of participation, and document everything. And then our maintenance is calibration.